It was 7 months ago when we first reported about the challenge the Guam Memorial Hospital is facing while trying to provide service to house patients. And since then, the situation has compounded. In January, a system change was made to the amount of hours hospitalists work from 24-hour shifts to 12-hour shifts. While this cut the tedious work hours, it has increased the need for hospitalists. As we reported, the hospital has 10 to 15 new house patients on a daily basis. And GMH Administrator Joseph Verga says they need at least 7 hospitalists to care for those patients who have no insurance and no doctor.
Yes, we are short hospitalists. We have lost 3 hospitalists over the last couple of months, which have compounded the problem.
Verga says these 3 hospitalists left for different reasons all around the same time, not giving the hospital enough time to react. The hospital now only has 2 full-time hospitalists.
Now, as I said, we do have 3 locums plus 2. We have our medical director covering, that makes 6.
But because of such a heavy workload, time off had to be given to the 2 hospitalists so that care would not be compromised. Verga says the shifts are covered, but it has been a challenge and GMH is stretched thin.
This would really be no problem if more physicians that were on island or credentialed at the hospital helped us out.
But many physicians have private practices, and a number of them who are opposed to taking house calls fear that their private patients will suffer.
Not all physicians on the island pitch in and help out and cover shifts and take calls. So, for example, we have more than over 15 internists on staff, and if all of them at least pitched in and took a shift a month, there would really be no problem.
In fact, Verga has a plan to address the Department of Internal Medicine to ask physicians to pitch in to solve the problem. If not, there's talks about a regulatory solution which would mandate such a thing. At this time, the hospital has turned to their contingency plan, hiring costly locum firms for temporary staffing and placing the medical director on the floor. But this is not a permanent solution. While the medical director is on the floor, Verga says in the interim, duties of the medical director will be reallocated to another individual, as the demand for service has increased, adding to the situation. He says patients are sicker and have multiple problems and are not getting the care needed in the community, creating a public health crisis, making hospitalists work harder.
And so that's what you're hearing. You're experiencing a lot of fatigue with managing many patients with multiple problems. It takes longer to interact, to see one patient with 3 or 4 problems than it does to see one patient with 1 problem.
Verga says the increased workload is frustrating to the doctors, as other physicians on island are not helping. And while the hospital is actively trying to recruit full-time hospitalists, there is a national shortage for physicians. Reporting for Guam's News Network, I'm Jolene Tovis.